everybody. Welcome to Mental Health Matters, the podcast that promotes the breakdown of stigma. The podcast that is supported through St. Louis Counseling, stlouiscounseling.org. Check us out. Spell out Saint, stlouiscounseling.org. So yes, this is Mental Health Matters. We're going to talk about some mental health themes. We're going to make talking about mental health okay around the dinner table, right? Maybe it's the lunch cooler, or it's the lunch table, the lunch counter, and then the water cooler. So as always, we have some interesting conversations, some interesting topics. And if you are interested in supporting this podcast, feel free to contact Debbie Dugan at DDUGAN@ccstl.org. And one of the best ways you can promote this podcast is share it. Tell people about it verbally. Tell people about it by clicking the share button on Facebook, on Twitter. Just get the word out because we are changing lives. We are doing great work, and we have these talented clinicians at St. Louis Counseling that are making impact in the lives of others. So today on our podcast, we're going to do something a little bit different. So often we get questions. We get questions about just like, what is therapy? What is counseling? What's the difference between the two? Some might call those frequently asked questions. Let me say that again. Frequently asked questions. So what we've done, Miss Debbie Dugan and I, we have compiled a list of questions that we've received from others. Sometimes these come through on the website. Some questions are actually on our website. So check that out with frequently asked questions section. But today we're going to talk a little bit. So we're going to just do a little question and answer with some of these additions and emails that we had from people. So without further ado, I'm looking to the crowd. I'm looking for a question. Debbie Dugan?
Mr. Duff.
Indeed.
Yes. I'm not calling you Captain Counselor. I'm just telling you that. Or
Come on.
Mr. Therapist.
Nope. Captain
Nope.
Tom?
No.
No. Okay. Question one.
How do I know when it's time to seek out counseling?
Okay. Right off the bat. So a lot of times I preach about know thyself, right? So if you are recognizing some differences in your lives, some patterns of behavior, some problems with interacting with others, maybe just your mood is not the same that it used to be, or it's the way it used to be, your mood, your personality, and you're not happy with it. All right. That's a good time to say, maybe I should go seek out counseling, because it's an opportunity to address issues within ourselves, issues that we might be having with others, and it's really about this self-awareness. So if you're not happy about something, or you've noticed a change in your worldview, in your life, and also if it's impacting your life. So we may be very thrilled with how things are going, right? And then all of a sudden something happens and we're just not happy, but our life really didn't change. We're still handling it, we're coping with it. No, you probably don't need to seek out counseling. But if it's something that's having an impact on your overall level of functioning, or you just have this constant need or this urge or this desire to make some change, that could be a good sign that it's time to seek out counseling.
So why is a counselor different than talking to my friend or loved one?
Okay, so a counselor, therapist, a lot of times I go back and forth changing those terminology, but basically I'm saying the same thing, counselor, therapist. They're this objective third-party listener that is trained in different modalities of interventions and treatment techniques, right? And it's non-judgmental. That's the other side of this. So you're going into somebody that doesn't have any baggage with you, that doesn't have any preconceived notions. They're trained to be this third-party objective listener, right? Non-judgmental. So a lot of times you go in there and you can say whatever you want, and you're not, and that's what you need to do, first of all, and not feel like you're being judged or that you're going to affect a pre-existing relationship. Because with a friend or loved one, you start sharing some of these things. Sometimes they don't know how to handle it, first of all. They may not be trained for the level of issues that you might be describing. Or it's such a sensitive subject that you're maybe not ready to present it to that friend or loved one. And so you got to talk it out with the counselor or the therapist first. So bottom line is, as third-party objective listener, that can give you objective feedback. Sometimes with our loved ones, it's hard to get that objective feedback because they may not want to hurt our feelings, or they may not tell us the truth. And then sometimes we might not tell them the truth either because of a fear of damaging that relationship.
Okay, that was very helpful.
Thank you.
Thank you.
I see another question.
You sure do. How do I pick a therapist or a counselor?
Good question. Good question. So that is the right pairing, the right relationship, therapeutic relationship is the key component, to make treatment work. So first of all, how do I pick a therapist? I believe that it's always good to ask some of the people surrounding you if they recommend somebody, because a lot of times they will know you and they may know a therapist, or they went through therapy themselves and they might have a good recommendation on somebody that worked for them, or that they know of somebody that has really good skills. Um, so I always kind of believe that searching that out, first of all, with someone you know. Asking a doctor, like it might be your primary physician, do you have a referral? Is there certain therapists you refer to more than others in that aspect? Now, the other side of that is a lot of times we are picking out therapists or doctors, right, through our insurance plans. And one of the things I've consistently heard is how overwhelming it is. Like, okay, here in St. Louis, I have United Healthcare, and I type in counselor St. Louis, and 1,000 people's names pop up, right? So you can go through there, you might get a little blurb, you might be able to see if it's male, female, therapist by name, you might be able to make some of those assumptions. But the bottom line is it gets really overwhelming. So that's why, certainly if you want to use insurance, you got to make sure that that therapist accepts your insurance, that therapist is credentialed. So that's part of that process, of course, because it can be expensive just to pay out of pocket, which it doesn't always have to be expensive. But, that's one aspect. But then two, seeking out some informed decisions in that standpoint, or informed opinions, so to speak, from people that you care about. And that care about you. I think the other thing is, as I go back to saying, and if it doesn't work out the first time, don't think that all therapists are not cut out for you, because that's the other side. You got to find the right personality, the right fit with the person that you feel comfortable talking with. So if it doesn't work the first time, try it out again with somebody else.
Okay. Good advice.
Are you
again.
feeling well informed?
I am feeling so informed.
Okay, we're rocking.
We are. So when do therapists usually work? Is it day, evening?
Good question. Good question. We have that pop up a lot too, because people have lives outside of going to their weekly or every other week therapy appointments, right? So depending on where you're seeking out services, therapists that work inside of an agency, therapists that have their own private practice, so you have to go to their website, you have to give them a call. But generally, you can find therapists that will work early morning to late evening, and every time in between. So that's really important, and the flexibility of that therapist to fit your needs. So when you're choosing that therapist, just know that there's therapists out there that get going at 7 a.m., which means you could probably get there before work. There's therapists that will see you on your lunch hour. There are therapists that can see your kid right after school or well into the evening. So it's similar to scheduling a doctor's appointment with your regular physician. But basically, there's access to therapists from that perspective. And then there's also from a crisis care line, there's always 24-hour care with suicide prevention and things of that nature. Here locally, you have BHR that can help with some of those calls and directing people for the right services. And as always, if there's ever a medical emergency or psychiatric emergency, 911 is always a great time to call, or number to call as well too.
So one question that I do hear from people is that it could be kind of scary and intimidating to go see a therapist. So what do I do when I get there?
Okay. So
as a client.
As a client, you're walking in the doors, right? So that's the first step, making that appointment. All right. Well, maybe you don't have an appointment. You're just walking in the door. So here's what to expect. Depending on what agency you go to, what individual therapist practice you might be going to. There's probably going to be an office manager, a secretary. At St. Louis Council, we have an intake specialist that's going to take just some basic information. If you have insurance, you're going to turn your insurance card in. You're going to fill out some HIPAA forms like you do at your general doctor. I think we all know those forms that we have to fill out. Then you're also going to maybe fill out some demographics like you might at another doctor's office. So some very basic paperwork, right? Then you're probably going to be sitting in the waiting room, a little waiting area, depending on where you're at. That can be a very small one with just a couple comfy chairs, or maybe it's a larger agency that you're going into and there's multiple chairs and there might be other people waiting to see other practitioners or clinicians that are there. So I compare it a lot to just anywhere between going into a hospital waiting room where you have a bunch of different people to maybe a hairdresser waiting room, waiting to go see your hairdresser or your barber. There's going to be some chairs around there. And then after that, your therapist is going to come and call your name and say, they're not going to say your full name. They might just say, Debbie, are you ready? And then you'll come on back. Once you get back to the therapist office, it's not always like the stereotypical way of, please lay down on this couch. I'm going to sit in a chair right by your head with a pencil and a notepad, and I am going to ask you all these specific questions about your family, and I want you to close your eyes. It's not like that. There's a lot of stereotypes like that. Yes, there are some forms of therapy that are totally psychoanalytic, that can sit down and lay down and what's comfortable. But a lot of times you're coming into, there's probably a desk in there, there's probably a couple comfy chairs, and you're just sitting across from each other. And that's how the conversation starts. Usually it's a well-lit room. Now, granted, there may be certain diagnoses where like someone with severe PTS syndrome or PTS symptoms can't have all that light, right? So we'd respect that. But generally, it's a well-lit room where you're just kind of comfortable. So I know I elaborated probably a lot on that, but it's kind of just get you in the door and what it's like to start with.
So, what do I talk about? Do I start from when I was a kid and what kind of childhood I had and go into all those details with every type of relationship I've had, or does the therapist do the asking? How does that work?
Yeah, so that's a really common one, and people, I think even people who've been in therapy before and then they come back to therapy, it's kind of the same question, like, man, where do I start? And my response usually back is this: well, you can start with, why did you want to schedule this appointment? And then let it go from there. Now, the thing is, you may go off in 100 different tangents. I may direct you back at a certain point if you're going off on a lot of different tangents. But those first sessions, right? I'm just here listening, because that's going to help me kind of steer in the direction of where you need to go first. And a lot of times, we always talk about active listening and repeating some things back to you, but that's to kind of help confirm, like, okay, as a therapist, I'm listening to you, and this is what I'm hearing, and this seems to be the topic that keeps popping up, and maybe that's where we should start. But ultimately, go in there and you just start talking, and it's easier than what you think. And our job is to listen and help kind of decipher the path that you'll go down.
So, is a typical session about an hour? Is it shorter?
Yeah, 45 minutes to an hour is usually typical.
Is that enough time to present what I have?
Yeah, so you also will feel like, probably going in there beforehand, you'll think to yourself, man, that's going to be a really long time. And then all of a sudden, the hour is up, and you felt like you've only been there 5 minutes talking, because it's probably going to feel that good. So the reality is, therapists, clinicians, counselors, they have appointments. So they have some back-to-back-to-back appointments, right? So our job is to kind of keep keep it condensed, keep it respectful of the therapist time, your time, and the next client's time. So usually 45 minutes to an hour is your typical session, so to speak, for a counseling session. And I think it's also important to know that one time usually doesn't address the major reasons why you're coming in. So that's the other question. Like, is one time going to be enough? You're supposed to solve. No, I mean usually we have our agent, our St. Louis counseling, our office-based counseling. We probably average about 8 sessions a person. We see a lot of people, but I'd probably say that average is about 8 sessions per person. So, it's yes, that first hour isn't going to be enough, right? But that's why we're going to ask you to come back and keep talking. And that second time you come back, we're going to have probably a plan already developed to help you focus on some of those key component and areas. And that's a beautiful part of client-driven feedback is you as the person seeking out the help, right? You're the one that's going to drive which problems, which issues, which areas you want to address.
So what if I'm there and, with HIPAA and everything, um, with privacy matters, what if I see somebody I know who's in the office, in the waiting room? Do I
Yeah.
acknowledge them? Do I ignore them? What do I do?
Yeah. So that's a common question too, a really common question because it relates to stigma, right? So I compare it to if you're in your general practitioner's office and you see your neighbor over there, right? Are you thinking twice about that question, right? For a lot of people, they do think twice. A lot of people we're trying to keep it hidden. We're afraid that something will come out, that people will talk about us, people will label us as what are those words? Let's see, crazy, bonkers. They're not in control of themselves, and you may think that may affect your job. That may affect all how people interact with you. I mean, those are all those things that get in the way and why we still have this stigma with mental health. So my first response to that question is like, hey, ask yourself why does it matter, right? If you see somebody, it's because of that stigma. That's why it matters. So, um, I don't think there's anything wrong with you can say hi to somebody. I would steer clear of saying, "What are you here for?" Because it is confidential. Just as you shouldn't ask, really. I mean, honestly, about if you see someone in a waiting room in an ER, like, "Hey, what are you in here for?" You shouldn't. I mean, it's all medical stuff. We all, I was raised anyway. You keep some privacy. Also, you don't want to be talking all in the waiting room about everything. So respect that person. If it is a conflict for you, if it truly is a conflict, so what you need to do then is you need to let us know that. We'll try to schedule around that if we know that. If you say, I know that's so, I'm a teacher and I'm coming in for counseling and my students in here and they're seeing someone, a different therapist at the same time, then let us know that and we will make plans to be able to adjust those times. Because ultimately, you do have to, as much as I want to say break down stigma, you're there for a reason and we want to help you.
So you talked about how fit needs to be really a key factor with your therapist. So how do you know if a therapist is a good fit or not? And how many sessions does it usually take to know that? What should I look for?
Good questions. Good questions. Okay, so I look at therapists as I want somebody who's a good listener. All right. So they're actually willing to listen to what I'm saying. I want somebody to also hear me. Right. So not only do I want somebody to actually be quiet in the room and let me do the talking as the client, I want a therapist to then be able to kind of not repeat back to me verbatim, but at least know that they can acknowledge what I'm saying. I also want somebody to not tell me what to do. You don't want your therapist to tell you what to do. That's not therapy, all right? That's that's probably got a few jokes I could use, but I won't. But you want somebody to offer options. You want somebody to say, here's the pros and cons. You want somebody to be on this journey with you as support. So a good therapist is offering you support. They're being objective. They're like, you may be totally sold like, hey, I plan on getting a divorce, and I know I've already thought it all the way through, and you don't want that therapist to say exactly, yes, that's a good plan. Let's work. You want the therapist to say, okay, but let's look at some of these other factors. Walk me through. Have you thought about this? Have you thought about that? What's the impact? You want someone to walk with you through there and be that objective person, right? Devil's advocate, as we say. You want a therapist that is willing to let you kind of drive treatment at the same time. You as the client need to be receptive as well too. You want a therapist. I think a good fit is somebody who the knowledge is there with interventions. So that's something you should be looking for as well too. Like when you're throwing some things out there to them, they're giving you some constructive interventions back. Like here's something you can try. But ultimately, it also comes down to personality, right? You may be more comfortable talking to a male than a female. You may need somebody more nurturing than like I'm going to hold you accountable to completing these homework tasks I'm going to give you. So you got to know that as well. So going into it, I'm a big proponent of know thyself, right? But going into it, if you know a little bit about yourself, then you can kind of judge from that therapist. It's kind of like a job interview in a way. You're interviewing them in that first session to see what they can provide you. And if you're somebody who, you don't want a nurturing therapist to just kind of be relaxed with you, you need somebody to tell you straight up what's going on, then that's the type of therapist you should be looking for. So part of it is knowing yourself and then seeing if you're a good fit or not. And in one session, sometimes is not enough because you may, one session in the sense of knowing if it's a good match or not, possibly two, three, because sometimes that first session you're already nervous, you're worked up, you're not sure, and so you might think clearly, and then maybe it wasn't the best interactions, but when you come back, then you get another glimpse of that. So
Now, our therapist, if you have to make a switch, are therapists offended if you go to somebody else?
like you try out this therapist, and like,
Right,
nah, I
right.
don't like you. Let me
It
try you
doesn't
over
fit.
there.
Yep, it's like a pair of jeans.
Yeah, exactly. Um, no, a
Okay.
good therapist should not be offended at all because we get into this field to be able to help others, right? And if I can't help you, I'm I need to be the one saying, "Let me find someone who can help you," or "Let's try this agency over here." That's one of the things I take pride in with St. Louis Counseling is, when people are calling us looking for services, and it's something outside of our expertise, we're not afraid to share other resources in the community. We're also, if we got a waiting list for some reason to get someone in to see counseling, we're not afraid. It's like, hey, we know this provider is really good. They might have some openings. We're not afraid of doing that. So a good therapist should not be offended.
Now, does everyone who goes to therapy need a psychiatrist as well?
Great question. No. Some people. So, kind of the differences, like with the two. So, I think that's some confusion as well for people. So, I'll start with that. A psychiatrist is a medical doctor, and they can prescribe medication. Some psychiatrists, right, will also see clients from a counseling perspective. Not all. There's a lot of psychiatrists that they may spend the very first time they meet with you about 30 minutes to do an initial assessment on medication. And then after that, you may come back monthly, you may come back every 3 months for 15-minute check ins. All right, because it's only about medication management. How are these meds doing? Are you feeling okay? Is there a difference in you with functioning, and then getting the refill, right? Where the therapist, which is a licensed clinical social worker, a licensed professional counselor here in the state of Missouri, those are some of the acronyms. They are not medical doctors, but they're trained in a counseling field or a social work field, and then they pass a licensure test, right, to get that L in front of their name, licensed clinical social worker, licensed professional counselor. And they are providing that counseling. So weekly, an hour-long session, that type of thing. And just because you're going to counseling does not mean you need medication. So that's another popular misconceptions like, I don't want to go to counseling, I don't need medication. No, 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 no. Medication is great when it's necessary, but sometimes through some cognitive behavioral techniques, and that's a whole different podcast, right? But people are able to work through their issues without taking medication. But if a therapist says, I think we might need to try out some meds, then they're going to refer to a psychiatrist who then can prescribe.
So I guess maybe one of the last questions that I, as a client, would have
Uh-huh.
is wondering if therapy, if you have to have insurance in order to receive therapy. So say I don't, am I still able and I need counseling? Can I get it?
Yes. Bottom line with that is yes. There are so many resources out there for people to get counseling. And the more we push legislation and advocacy to address some of these issues, hopefully it'll become even more open. But first of all, with insurance, insurance companies vary on and the plans. The insurance plans vary on the coverage for mental health care. Hopefully, at some point, we'll get to true parity when it comes to mental health and physical health. That same copay, even that'd be great. But check with your insurance company and see if there's a benefit for and coverage for mental health for counseling. Outside of that, there's just here in St. Louis, right? Different grants from the county perspective. Missouri does a great thing and offer the chance for counties to pass a sales tax that can go for children's mental health. There are grants out there to cover adults for mental health. It depends on where you're going, what agency. St. Louis Counseling offers there's private pay. There's people that actually just pay out full price out of pocket, $100, $120. They'll just pay, right? There's people that use their insurance and there's a copay that they pay. There's people that may be struggling and they have to use a sliding scale, right? So we have that. And there's many different other opportunities out there from a mental health perspective to get coverage. We can get you, there's a lot of resources in the community. And a lot of times we hear things such as, man, there's not enough resources. And I challenge that a lot of times is we have to be more diligent about bringing awareness to the current resources that are out there. And us as nonprofit providers also need to be aware of those. It's not just community members knowing those resources. It's us in the nonprofit world. And really every business should know that there's these ton of resources out there, and if I can't help you, I bet someone else can, because there's funding and all these different components. But yes, don't be afraid if you don't have insurance or if you don't have money readily available. Seek it out and let's see what we can do.
Thank you.
I'm looking for one more question. One more question.
One more
Anybody? Anybody?
question.
No, nobody's got any more questions. Oh, you're just gonna shut people down. So anyway, that was actually kind of fun. So like I said, that was just a small sample of the compilation of questions that we've been collecting through website, through some social media, just through experiences too with clients and what they've said to us, and even some of our podcast guests as well too, and what they've talked about beforehand. So bottom line is like, let's make it okay to go to counseling. Right? The people that go to counseling always say, like, I don't know how I live without my counselor. I mean, you hear that. I hear that more and more, and sometimes, I had to get past the stigma associated with mental health. I grew up thinking like, oh, you don't talk about your problems to anybody. Pull yourself up by your bootstraps, and I've learned over time, not everyone can do that. So let's open doors. Let's open our minds. Let's open our hearts to helping others. And also, let's not judge others. All right. So this has been Tom Duff with the one and only Debbie Dugan. That's DDUGAN at ccstl.org. Thank you, Debbie, for a wonderful question and answer. I was hoping you'd use more of your British and Southern accents, but that's
I need
okay.
to brush up on those next time, perhaps.
Next time. There's
We'll
always
see
a next
what
time.
We can muster up for that end, but
There we go.
for today, it's the St. Louis accent.
That
The
St.
St.
Louis
Louis
accent.
dialect, whatever you want to call it.
Well, as you said, there's always next time. As a Cubs fan, there's always next year, and baseball season's right around the corner. So until next time, this is Tom Duff with Mental Health Matters.
This has been Mental Health Matters with Tom Duff of St. Louis Counseling Services. Check out stlouiscounseling.org for more information.